Now, about 1 in every 5 people in Ghana experience mental health problems at some point in their lives. That's according to the country's Mental Health Society. That's nearly 6 million people, and many of them go untreated. Now, technology is helping to change that. The BBC's Thomas Nadi has more.
Abraham has been experiencing signs of depression. He is here at the Kasua Polyclinic to see a community psychiatry nurse. Abraham can't show his face because there's still a lot of stigma associated with mental health problems in this country. He tells me how his problem started.
My problem was it's a financial problem. I had to get money to cater for myself, my younger brother, my family as a whole, and then there was no work, so that depressed me because I couldn't just work again because of my backache.
Since you visited a psychiatric unit, has there been any improvement?
It has changed me a lot. I just couldn't sleep, but when I listened to her advice and how professional she was, it has helped me to gain much sleep and then rest myself.
Using an app called MindITGH, the personnel answering the calls are paid for by the government. Customers are expected to dial a short code and then answer 4 basic questions. So depending on their answers, the personnel here will call them for further details and then refer them to the nearest community psychiatric unit if necessary. Dr. Achulati is the founder of MindITGH. He became interested in mental health when he was in medical school.
I published an article on depression in my newspaper column. So a woman in a remote part of Ghana contacted me that she identified herself with all the symptoms I had stated. The help I got was not affordable to her and it was quite far from where she lived. So eventually it dawned on me that there were people like her who may be experiencing the same thing, that's not knowing what they were going through, not having money to access the care, and then with the health centers being very far from them. So I thought of a way to screen the population for psychological distress.
In the past 2 years, 8,000 people have used MindITGH services. Nurses diagnose and prescribe medication. If there's the need to see a psychiatrist, then they refer the patient. The short code was incorporated into the Ghana Mental Health Authority call center services this year and is free of charge. Mental health issues have been neglected in Ghana, where there are only about 18 registered psychiatrists for a population of over 30 million. At least now, with applications like MindITGH, some people suffering from mental illnesses have hope of getting treatment. Thomas Nadi, BBC News, Ghana.
You're watching BBC